thought we would talk about spinal cord injury. And it's the type of injury we see on holiday weekends. That is to say, it's usually an injury of young, healthy men, as opposed to other groups being older people or women or even children. And of course, we see this type of injury because this is the time of year for diving into swimming pools and climbing up trees and falling off the trees and driving too fast and perhaps under the influence and often without wearing a seatbelt. And this is the type of injury which is particularly devastating because the victims are usually young, healthy men who, by and large, are more athletic, more physical than cerebral. And then after the injury, if there is a significant paralysis, they are no longer physical and they're forced to be cerebral. And this is a huge change in terms of lifestyle, in terms of the way to look at the world. So I thought we'd talk about it a little bit. First, the good news. The incidence of spinal cord injury is down in recent years. And part of this is education. Don't dive into a shallow pool. Don't dive into any water without checking first to see the depth. Don't drink and drive. Wear a seatbelt while driving. And be careful in any other physical activities, whether that be surfboarding or climbing trees or bungee jumping or doing anything else. And we have seen this happen in recent years. We have seen people behave more responsibly in a more mature fashion, and as a result of that, we've seen a diminution of spinal cord injury. When we talk about spinal cord injury, we have to talk about two elements. One is the injury to the spine itself, and the spine is the supporting structure which allows us to stand upright without having an exoskeleton and therefore carrying a huge amount of weight on our shoulders. So the spine as a structure is basically a bone which is segmented to allow movement. At the same time, the spine provides covering and protection to the spinal cord, which is the main nerve, if you will, connecting the brain to the rest of the body. So in order to move one's arm, the brain has to get the message to the arm by means of the spinal cord. That's the conduit. The message has to get to the leg to move the leg through the spinal cord. That's the conduit. So the spine then serves two functions. One, it allows for support, and two, it allows for protection. Similarly, spinal cord injury or spine injury affects two things. Number one, it affects the integrity of the bony structure, fractures, dislocations, but it also affects the occupant of that protective case, the spinal cord. So we can have a bony injury without a spinal cord injury or without neurological deficit. Similarly, we can have a neurological injury without too much in terms of a bony injury if the substrate is ripe, if the perfect storm exists. More often, though, we see both the bony injury or bony/ligamentous injury and the neural injury simultaneously. We talk about the neural injury as being either complete, meaning that there is no evidence of transmission through the injured site, or incomplete, meaning that there may be some evidence of transmission through the injured site. Well, what's the difference? The difference is huge because most people with incomplete injuries will recover at least to some degree, whereas most people with complete injuries probably are not going to recover to any significant degree. How is spinal cord injury treated? Well, the number one treatment, as I mentioned, is prevention. But assuming that that weren't successful, then the treatment begins at the moment of the injury with identification that there could be an injury, proper extrication without making the injury worse, proper transportation, again, without making the injury worse, and then verification at the hospital of the injury having occurred. Now, over the years, there have been a number of medicines given in the field or in the hospital. There have been a number of surgical treatments for cooling the spinal cord or protecting the spinal cord after the injury occurs. Unfortunately, none of these treatments has really been overly enthusiastically successful. The best thing we can do with spinal cord injury is prevent it. The second best thing we can do is prevent it from getting worse by properly evacuating the person from the car or from the swimming pool, by transporting the person properly on a spine board, which now all of the ambulances and paramedics have and are familiar with looking for, and then properly taking care of the patient at that initial treating facility, identifying the fact that there may be a fracture, even without paralysis, and therefore this is a very unstable situation, and the patient has to be handled properly to avoid this negligible neurological deficit from becoming a major, devastating neurological deficit. Injuries can occur in the cervical, in the thoracic, or in the lumbar spine. The thoracic is less likely injured because of the protection of the rib cage and the stability that that offers the spine. More often the injuries are either in the cervical region or in the lumbar region. If one region is injured, then there's about a 20% chance that there will be a non-contiguous second injury. So that has to be borne in mind at the time. With cervical injuries, especially if there's a neurological deficit, we have to pay attention to the ABCs. Is the airway protected? Is the patient breathing properly? Is the blood pressure under control? Because, especially with the higher cervical injuries, these functions can be impaired, much to the detriment of the patient. Initially, the job of the physician is to identify the injury and then to stabilize the spine. Usually that's done on a special type of bed with traction. And then at a later date, surgery may be necessary to stabilize the spine or to actually decompress the spinal cord. It's rare that the spinal cord has to be decompressed on an acute basis, but that sometimes happens as well. From the very moment of the injury, we must think about rehabilitation. Not only rehabilitation of the physical body, the muscles, the tendons, the skin, but rehabilitation of the mind. Because obviously this is a devastating injury. This is an injury which is always accompanied by severe depression. And the patient who suffers the injury goes through the routine, the typical stages of depression and loss. But hopefully as physicians, as healthcare providers, our job is to help the patient cope on the physical side as well as on the emotional side. Remember, though, that the best coping is to prevent the injury in the first place.